Good evening, wherever you are. This is Vesper Quill from ConferenceHype. Our segment will focus on 2025 Donald Selden Lecture, Leveraging Diverse Population Genomics and Multiomics Integration for Gene Discovery of Cardiovascular and Kidney Diseases, from the 2026 July 22 edition of Hypertension. This review discusses the implications of frameworks leveraging genetic admixture and multiomics data for advancing gene discovery in cardiovascular and kidney disease research. By broadening gene discovery efforts to additional populations that have a disproportionately high risk of disease and leveraging genetic diversity in admixed populations, studies can identify population-enriched risk variants that traditionally have been missed in genome-wide association studies. The use of multiomics approaches, including the transcriptome, proteome, and metabolome, advances a mechanistic understanding of disease beyond associations. As single-cell omics technologies continue to improve, their integration into gene discovery may help uncover cell-type-specific regulatory pathways and more precise biological contexts. The full potential of these approaches depends on sustained investment in diverse, well-characterized omics datasets, methodological innovation in multi-ancestry statistical approaches, and interdisciplinary collaboration bridging genomics, epidemiology, and clinical medicine. From the 2026 May edition of Hypertension, background, confirmatory testing to identify lateralizing primary aldosteronism is of uncertain benefit. Methods: blinded clinical trial where patients with high-risk features for PA underwent the seeded saline suppression test. Results: a total of 160 patients completed the trial. Discussion: aldosterone suppression testing is unreliable for anticipating adrenal vein sampling outcomes. From the 2026 May edition of Hypertension, background, new guidelines recommend testing for primary aldosteronism in all people with hypertension. Methods: 858 adults from across the U.S. meeting traditional guideline criteria for PA testing underwent testing. Results: mean age was 62 plus or minus 11 years, with 54.6% women, 14% Black, and 22.9% Hispanic. Discussion: in this large, diverse, nationwide sample, older and Black participants had higher aldosterone to renin ratio and higher odds of testing positive for PA, and women had higher aldosterone levels than men across the lifespan. From the 2026 May edition of Hypertension, background, spironolactone is recommended as first-line therapy for patients with idiopathic primary aldosteronism. Methods: we retrospectively included 394 patients with primary aldosteronism receiving spironolactone. Results: the median follow-up after the introduction of spironolactone was 12 months, and 128 patients experienced adverse effects, with a proportion higher in men than in women. Discussion: treatment with low doses of spironolactone, in association with other antihypertensive drugs, is effective in achieving an appropriate blood pressure control in primary aldosteronism, while it improves adherence with lower adverse effects.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 July 22 edition of Hypertension, background, primary aldosteronism is a common and treatable cause of hypertension, yet data on the durability of medical treatment response beyond the first year are limited. Methods: we conducted an international, multi-center observational cohort study across 27 centers on 4 continents. Results: The cohort included 1,292 patients with a median follow-up of 34 months. Discussion: targeted medical therapy for PA can deliver sustained biochemical and clinical benefits. From the 2026 May edition of Hypertension. Background: mutations in the KCNJ5 gene, encoding an inwardly rectifying potassium channel, can drive aldosterone overproduction in a subset of aldosterone-producing adenomas and in familial hyperaldosteronism type 3. Methods: virtual screening of over 6 million small molecules identified compounds that putatively bind to KCNJ5 channels. Results: compounds antagonizing mutated KCNJ5 function were identified by evaluating their ability to rescue adrenal cell death induced by overexpression of mutant KCNJ5. Discussion: C81 shows potential as a small molecule antagonist to specifically target pathological aldosterone secretion in familial hyperaldosteronism type 3 or KCNJ5 mutated aldosterone-producing adenomas. From the 2026 May edition of Hypertension. Background: finerenone is a novel non-steroidal mineralocorticoid receptor antagonist. Methods: in this prospective, multi-center, single-arm, and exploratory trial, we enrolled adults with primary aldosteronism, an office blood pressure ranging from 140 to 180/90 to 120 Hg, and an estimated glomerular filtration rate greater or equal to 60 ml min per 1.73 m2. Results: 57 patients were ultimately treated. Discussion: this study demonstrated the efficacy and safety of finerenone in the treatment of primary aldosteronism, supporting its use as a potential alternative therapy for the condition. From the 2026 July 23 edition of Hypertension. Background: hypertension guidelines generally recommend uniform sodium restriction, although determinants of salt sensitivity, or sodium blood pressure responsiveness, remain incompletely quantified. Methods: PubMed, Embus, and Cochrane were searched from inception to April 2025 for sodium intervention trials and observational studies. Results: we included 160 studies. Discussion: salt sensitivity varied across age, SBP, and body mass index strata. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of Hypertension. Background: aldosterone-producing adenoma is a major cause of primary aldosteronism. Methods: peptide deformylase expression was validated in enlarged aldosterone-producing adenoma samples harboring different mutations and in adrenocortical cell lines. Results: both peptide deformylase expression and aldosterone synthase colocalization were significantly enhanced in aldosterone-producing adenoma samples. Discussion: peptide deformylase regulates CYP11B2 expression and aldosterone production. From the 2026 May edition of Hypertension. Background: adrenal vein sampling is used to guide therapy in primary aldosteronism. Methods: This retrospective cohort study included patients with PA who underwent AVS before and after cosentropin stimulation at a referral center between January 2015 and December 2024. Results of 460 patients. Bilateral AVS was successful in 437 patients at baseline and in all patients after cosentropin stimulation. Discussion. Considering the substantial overlap of RASI across PA subtypes, partially successful AVS has limited utility and is unreliable in guiding adrenalectomy for PA. From the 2026 Jun edition of Hypertension. Background: hypertension is a major contributor to cardiovascular morbidity and mortality. Methods: 14,840 UK Biobank participants with diagnosed hypertension and cardiovascular magnetic resonance imaging were analyzed. Results: 3 clusters emerged. Discussion. Clustering analysis identified distinct hypertension phenotypes with specific risk profiles, suggesting potential for improved stratification and more tailored treatment approaches. From the 2026 May edition of Hypertension. Background: aldosterone-producing cell clusters, which share some transcriptomic features with aldosterone-producing adenomas, are frequently observed in the adrenal cortex of aged individuals and those with primary aldosteronism. Methods: we performed an integrated analysis using spatial transcriptomics and single-cell RNA sequencing of APCC cells, aldosterone-producing adenoma cells, and zona glomerulosa cells present in the same adrenal gland of a patient with unilateral primary aldosteronism, with validation analyses conducted on tissue samples from 2 additional patients. Results: APCC cells exhibited a distinct cellular population with a gene expression profile more similar to that of the ZG cells than that of aldosterone-producing adenoma cells. Discussion. Our findings suggest that NR4A2 activation in ZG cells functions as a key molecular mediator in stress-induced APCC formation, at least in some cases.
This is ConferenceHype. Stay with us, coverage continues.
it for now for Conference Hype's coverage of the May 2026 issue of Hypertension. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.